Hello, everyone, and Happy New Year. Happy 2019. I'm your host, and welcome to another episode of Let's Talk Psychiatry. I've been away for a while, but I'm back here to stay. So, the last time we met, I talked about anxiety, and in that, we talked about panic disorder. So, today, we are going to continue in our series of anxiety, and we're going to talk about agoraphobia. Now, agoraphobia, what is that? I mean, what does it mean? It's anxiety regarding places from which escape might be difficult, meaning you kind of avoid places or situations that might cause you to panic. And it can cause you to feel trapped, helpless, or embarrassed. So that's what agoraphobia is. Now, to diagnose agoraphobia, according to the DSM-5 criteria, the person has to have a marked anxiety in at least one situation. Situation like using public transportation, for example, like the bus or the train. Situations like in an open space, like in a park or like the mall, or also situations in an enclosed space like in an elevator, a movie theater, or a store. Also situations like in a crowded place or standing in line, or sometimes when being alone on the outside the house. you know this anxiety is caused by the fear that there is no way to escape, or there is no way to get help, and is usually persistent for at least 6 months. It interferes with a person's ability to function in his daily life, and research studies believe that agoraphobia develops from a panic disorder. It may or may not coexist together. Now, people with agoraphobia have symptoms like people with panic attack, like the rapid heartbeat, hyperventilating, chest pain, trembling, dizziness. Some of those symptoms, they kind of like coexist together. Now let's talk about some history. In 1871, the word agoraphobia was derived from Greek words agora and phobia, meaning fear of the marketplace. And the word was termed describing people who are afraid to go alone in public spaces. Now, people with agoraphobia, they kind of avoid situations where it would be difficult to get help. They rather have friends, family members accompany them to places that they want to go. Some people, refuse to leave their house, like I said earlier. You know, that's to show you how severely affected people can get when they have agoraphobia. Now, get help and see a doctor when you have these symptoms of agoraphobia, and when it severely limits your ability to socialize, to work, or to attend important events like a birthday or wedding or anything like that. Now, treatment involves use of medications like the benzodiazepines, like Ativan, Xanax, those are the benzodiazepines, and then SSRIs and the tricyclic medication. Therapy includes supportive therapy, where the therapist promotes coping skills, offer advice regarding behavior. We also have behavioral therapy, where positive and negative reinforcements, desensitization, flooding, relaxation techniques, and sometimes hypnosis can be used. We also have cognitive therapy that can also be used. Lifestyle changes like exercise, healthy eating, avoiding alcohol and drugs like caffeine can also help. Now we're going to stop here, and the next time we're going to meet, we are going to talk about specific phobia and social phobia, also known as social anxiety disorder. Okay, so this is Let's Talk Psychiatry. Hope you have a wonderful 2019. Until next time, let's be aware of mental illness, remain stigma free, and I'll talk to you later. Bye for now. Take care.